Do you get headaches that start from the neck and the back of your head? Maybe after a long time on desk or screen time or on the phone. These are called tension headaches. And today I'm going to show you 5 simple exercises that you can do to reduce them. Most tension headache comes from tight muscles, poor posture, stress, and also restricted mobility in the neck. These exercises reduce the pressure on the nerves and the muscles, and that decreases the trigger of the headaches. So let's dive into it, and then end of the video we are going to also discuss one tip that can help you reduce your headaches. So first exercise is sub-occipital release. This muscle is behind the neck and the right at the base of the skull, and these muscles are very important for the neck mobility and the rotations. So what we are going to do is we are going to put both the hand on the back of the head, and then thumb goes right under where the skull ends. And once you put the thumb there, we are going to push with the thumb and do the circular motion to reduce the pressure on the sub-occipital muscle. These muscles are very important for the headaches because these are the main muscle. This has a trigger points in it, so when they are tight, they are going to create a lot of problems or the trigger of the headaches. This can be done for 3 to 5 minutes, and then we move to the next exercise, which is exercise number 2 is chin tuck. This chin tuck is a deep cervical flexor activator, and it also helps improve the posture as well. So what we do is sit nice and tall and guide your chin straight back. So you're gliding the chin straight back and you're getting the chin tuck. You hold for 5 seconds and then we do it for 10 repetitions. This is exercise number 2. Is very important for your headaches whenever you get it. Exercise number 3 is the upper trapezius stretch. So the tension in this muscle refers to the most of the pain and the headaches as well. This is the big muscle in the neck and the shoulder area. So it's very important that we stretch. So how we are going to do is sit nice and tall, bring your one hand behind you, and then tilt your head slightly gently on the side and hold for 10 seconds. You're gonna feel the stretch in the upper traps here, and this stretch again can be done 10 times and 5 to 10 second hold, and then as you repeat you should start feeling loosening up your muscles as well. Exercise number 4 is a levator scap stretch. This muscle is again attached with your shoulder blade and goes into the C-spine vertebrae, and when this is tight, it is going to create forward head type of posture, and it increases the chances of headaches. So we are going to start with turning your head towards 45 degree and then look down towards your armpit. Gently pull your head forward and down. This muscle pulls the neck forward and compresses the upper cervical joint, often causing the headaches. So when you reduce them, you're decreasing the tension on the muscles. Exercise number 5 is the deep cervical flexor strengthening. Now these muscles are the front muscles in the spinal column, not these muscles but just in front of the spinal column where the vertebrae are, and this helps to keep your neck more straighter and not in the slouch posture, which is important for the headaches. So what we do is we can lay down on your back, make a very small nod like you're saying yes, so you're creating a chin tuck. So hold for 5 seconds, and then once you hold for 5 seconds, we're gonna lift up the chin, lift up the whole neck, keeping the node yes or chin tuck, and then we are gonna hold for another 5 seconds. So this is also 10-second exercise, but you are holding for 5 seconds just the node and then a little bit off the ground, and this can be done 10 to 20 reps. You can increase the reps, you can increase the time how long you hold as well, and you're strengthening these muscles. It's very crucial that we make sure you don't feel so much pain, because as you feel pain, your muscles are going to spasm and tighten up, and it can create more problem as well. So let's say these are the 5 exercises. Now what is the bonus tip about the headache is, so whenever we have headaches, we don't have a normal breathing pattern, and how are we going to do the breathing reset? It's called reset. So mostly when we are anxious or stressed out or we are in a poor posture, we tend to not breathe normal. and that needs to open up in order to get more airflow or blood flow, good blood flow with oxygenation to the brain. And for that, so here we are going to put your hand on the chest and the tummy, and just going to see when you breathe in, we're gonna hold for a few seconds there and make sure your rib cage is rising when you're breathing. So you're taking the breath from your chest and letting it relax. Because of the tight muscles, the rib cages get restricted and we don't do the normal breathing, and that sometimes contributes to your headaches too. So breathing reset is so much important. Now, when to do this exercise and when not to do this exercise. So do this daily, 7 days a week, 100%. Now, if you do these exercises and your headaches reduce, you need to do it. It is coming from your neck. It is cervicogenic headache. Now, if it is not reducing and you're feeling more headaches, dizziness, and sometimes more tingling, or maybe you're getting very more like so much more vascular headaches, then we need to get medical attention. You need to talk to your doctor and stop the exercise. I hope this exercise helps reduce your headaches, and I hope this makes a difference. If you have more questions, please drop it in the comment. Thank you for watching. Goodbye.